Good afternoon, South Coast. It's Mike Sylvia, New Bedford Guide Fall Reporter. We're here to talk a special topic. It's Breast Cancer Awareness Month, so we bring in some of the doctors to help spread some of the awareness and getting checked out and answer your questions. So hope everyone had a good weekend. Happy Monday. Today I'm live with Dr. Keren Braithwaite. She's an MD at Southcoast Health, and we're going to talk Southcoast Health Breast Centers and Breast Cancer Awareness Month. So welcome to the show. And if you could just give people an introduction about yourself and what your role is at Southcoast Health.
Sure. So my name is Dr. Braithwaite. I'm one of the three breast surgeons here at Southcoast. We are mainly operating out of the breast center. We have three breast centers here at Southcoast, one in Fall River, one in Dartmouth, and one in Wareham. And I'm one of the breast surgeons here at the breast center.
Yeah, so October is Breast Cancer Awareness Month. What's the importance of a whole month being dedicated to this, and what type of awareness are you hoping to spread out there?
So the importance of October being the Breast Awareness Month is, of course, more than half the population are women, and women have just an inherent lifetime risk for breast cancer. So it is very important to dedicate a month to at least get the word out for screening mammograms, making sure that people are aware that that is available, especially to women over the age of 40. And that this is why it is such an important month. Also, we want to make sure that people are aware that this is something that we can easily treat, especially if it is caught early. So we want people to be aware that all of those services are available here at Southcoast.
Yeah, people understand that these are not these are not facilities at the actual main hospitals like Toby or places like that. This is actually their own centers, right?
That's correct. So we do have, it's actually a women's center where it's dedicated to radiology for women. Mostly it is dedicated to breast imaging, and these are standalone from Southcoast. You do not have to go into the hospital. The three centers are close to hospitals, but it is completely dedicated to women where we do the mammograms, we do the breast exams, and it is not something that you have to go into the hospital with other concerns of getting sick or anything like that. This is completely outpatient, and we have dedicated people to do the mammograms and do the breast exams here. So definitely standalone, but affiliated with Southcoast, of course.
Yeah, early detection is probably the most important thing with cancer outside of exercise and great diet. What kind of screenings does the breast centers provide?
So the number one screening that we have here are screening mammograms, and screening mammograms have been around for many years. The importance of doing a 3D mammogram is what we want to make people aware of. 3D mammograms are still the same machine where you get your breast in the machine the same way. It's just the technology. So 3D mammograms actually allow the radiologist to see your breast with more depth. And what they do is the technology, it sort of slices or cuts your breast into little images so that the radiologist can take a better look at your breast. So that's the type of screening that I think most women should be getting at this point, since the technology has been available now for several years. And that's what we offer here at the breast center. So that's for screening, also for diagnostic imaging. As well as other things such as ultrasounds of the breast as well. So, but the main thing that we want to make sure people know is that the screening mammograms have to be 3D, and that's what we have here, and that's what we offer.
Yeah, so screening's important, but also preventive care is important. Most doctors you talk to, exercise and healthy diet, no smoking, carcinogens like alcohol, those kind of things. Am I kind of hitting the main points?
You're hitting the main points. I know that it sounds very broad to say, oh, well, eat, exercise, but I just want people to know that your best version of yourself, the healthier you are, the better it is. Definitely, if you don't smoke, don't start smoking now. If you can quit smoking, that's actually a very good thing. I always try to tell people that eating healthy is so broad, but what I try to kind of tell people is be positive about it. Talk about, whether something is more nutritious or nourishes you a little bit more. So if you think about it, vegetables are more nutrition, offer more nutrition than a piece of cake, if you will. So I put it more in a positive spin about it. What will nourish my body better? And then exercise is very different for everybody. We just want you to get moving, get your blood flowing. It does not mean that you need to run a marathon every day. That's not for everybody, but at least doing some sort of exercise, such as yoga, that is going to be very important for everybody. So, exercise and healthy diet looks very different for everybody, but if you do your best with that, that's actually very good for prevention and being the healthier you.
Yeah, I think as simple as, especially after COVID, is just walking, right? 30, 40 minutes,
Yes.
every other day or something just very simple, something that you can do, especially if you're maybe overweight or something like that. You don't want to go to the gym and injure yourself. You want to start off something very simple, maybe do some walking, ride a bike, get to that next level, and maybe, progress from there. Um,
Yes. Yes,
so yeah. So besides breast cancer screening, what other comprehensive breast care does your facilities offer?
so definitely the number one thing that we treat at the breast center is breast cancer. So we do have a comprehensive center in conjunction with oncology to treat breast cancer. Breast cancer is best treated in what we call a multidisciplinary fashion or a team fashion with other doctors, other specialties. So that's going to be very important, and we do offer that here. But besides the breast cancer treatment, we also help people that are higher risk for breast cancer, such as people that have sort of some genetic mutations, such as the most popular one, BRCA mutations. So we do help those people with extra screening because they need it. They're at higher risk. Also, people that have multiple first degree relatives with breast or ovarian cancer that we know that are higher risk for breast cancer. So what we do for them is we do risk screening for them a little bit different than the average person. So we do treat that as well as other benign processes such as fibroadenomas, which are benign common tumors that women can have, and also like sort of like breast infections, etc. So not just breast cancer, but other things as well.
Yeah, I think it's the most notable person is Angelina Jolie. She tested for you said it's a BRCA gene, right? So she tested, which gave her, I've heard it's as high as like 60, 70% chance of getting breast cancer. So she did preventive surgery. And that's something that, people should potentially get, tested because it's not always your diet, it's your genetics so well. And those both play a factor.
Yes. So actually, that brings it's a good point. The overwhelming majority of people that get breast cancer are not like Angelina Jolie that have some sort of genetic mutation. That's about 85% of people roughly are just sporadic, meaning that we just got unlucky to get breast cancer. But people that are higher risk, such as Angelina Jolie, can have different options. She did do uh, took out most of the risk for breast cancer, which is doing bilateral mastectomy. She did reconstruction. Not everybody that has a genetic mutation have to do that, but definitely that is part of the counseling that we do here at the breast center. If you're at higher risk or you have some sort of genetic mutation, or if you want to be referred for genetic testing, that's something that we can definitely do here at the breast center. And it's to help guide you as to what your next step should be, the type of screening that you should have, surveillance, etc. So all of that we do offer here.
But bottom line, if you have a history of breast cancer in your family, it's something you should probably go in earlier instead of waiting until you're, say, 50 or something like that, right?
Exactly. If you have, especially if you have several first degree relatives that have had either breast or ovarian cancer or a male relative with breast cancer, then that is actually one of the red flags for somebody that's had higher risk. Yes.
So let's go over the locations again, just so people know, because these are not at the actual main hospitals. These are their own facilities.
Yes, so we do have our breast center in Fall River, which is close, like a block away from Charlton Memorial Hospital. It's on the third floor. And we do offer imaging and clinical exams there, as well as the other center in Dartmouth at Fons Corner Road, right off the highway. Again, breast imaging and breast surgery services as well. And then our third location out in Wareham is in the Rosebrook location. That is also another location where we do have one breast surgeon and imaging services as well. So Rosebrook is not a Toby hospital. It is close by, but it's not there. The same thing with the location at Dartmouth, which is in the Fons Corner location. We're not in the hospital, but they're outpatient settings.
Yeah, I actually like the last few years, South Coast Health has kind of put some of the care into the community as opposed to having three main hospitals. Now you have these urgent care facilities, you have these breast centers, you have a cancer center in Fairhaven. It's kind of nice that you don't have it all in one facility. It kills parking. It makes it really congested. It's kind of spread out in the community. Um, if, if people want to learn more, is it southcoasthealth.org? Is that the primary location you're going to go to?
Yes, that's where they can go and find information. Even if you don't have a primary care, they can refer you to have your mammogram. Definitely calling or visiting that website that you just offered. It's one of the best resources so that you can even schedule your mammogram. And when you go into that website, you can find information about what would be closer to you and how to get in touch with one of us.
Yeah, preventive health is the most important. So, exercise, diet, get the early testing, those kind of things. So I'll let you close with anything you want to close with, and we'll say goodbye.
No, I appreciate the opportunity to get the word out to the community. It seems sort of simple, but we also want to make people aware of the services that we offer to the community. Like you said, we just don't want you to think of the hospital as when you get sick. We want you to think as the centers as taking care of yourself, being proactive, getting your screenings done, and we do appreciate the opportunity to get that out to the community.
Yeah, share this video, tag any woman in your life that you think should get information on this. Don't wait until they say over 50 people start getting screenings. But if you have a high risk, you have family issues, there's information's there. It's there. Get off of the Twitter app or Facebook app and go to the website, check it out, get the right information, and really education is going to be key in this and preventive health. So thanks for tuning in. Thank you, doctor, for coming in and sharing
Thank
your wealth of
you.
knowledge, and we appreciate it. Everyone have a good week.
Thank